Sanctuary Radio Show, and we are here in the studio. And so, like, we are about to start the broadcast. So give me a second to go to my script and to have the engineers, Jessica and Shane, cue me in. Give me 1 second to share this with my Facebook page. One moment. And then your person can share once. Are they just going to see it and then they're going to share it? Okay. All right, it's coming up. 1 second. Just give us a second. Okay. Oh, okay. I got it already. Perfect. Okay, Jessica, I am ready. Okay. Welcome to the Sanctuary. You're listening to DC Radio 96.3, HD4, and DCRadio.gov. I'm Wendy Cherry, your host, and we are back for season 2 of the Sanctuary Radio Show. And today we are talking about something very interesting. We're talking about holistic, bio-friendly, eco-friendly dentistry. So I have my own dentist, Dr. Terry Victor, here in the sanctuary with me, and he created one of the first holistic, biological, and eco-friendly dental offices on the entire East Coast. As a holistic and biological dentist, he is dedicated to the improvement of the overall health of each of his patients, working alongside their medical doctors, providing them with the best patient care possible. And on a daily basis, Dr. Victor works to create a safe and a healthy environment for his patients, staff, and the planet. So welcome to the studio.
Thank you very much, Wendy. It's a pleasure to be here. Thanks for having me.
Of course. So whenever I start one of my shows, with my guests, I always like to ask them, like, how did they get into this? Because like we've all had dentists, if we're lucky. I mean, not everybody even has a dentist, but if we're lucky, we all have a dentist, and we've been going for years. And but I have never had a biological dentist or eco-friendly dentist before. So what does that mean exactly?
Well, the way that I look at it is that you always have to be consistent in what it is that you do in your life and in your thought process. So you'd ask, how is it that I was able to get to this particular point where I'm a holistic dentist?
Yes.
And how I was able to do that was that when I was in dental school, my thought process and my philosophy has always been about health and alternative health at that. So when I got into dental school, I realized what it is that they were teaching me was not really alternative at all.
Okay.
It was actually very, very traditional. So they're talking about like surgery and pharmaceuticals and those sorts of things. And that really wasn't kind of like vibing with how it was I wanted to live my life.
Okay.
And how could I tell my patients to go ahead and get this surgery and go ahead and use these drugs if I myself wouldn't want to use it?
Right.
It's kind of like you're being schizophrenic, right? So
Right.
I tried to be consistent in my life. So in that consistency, I thought there must be a way that I could practice that really kind of like really incorporated what my belief system was, because I wanted to stay true to my belief system.
Okay.
So I ended up, you go into different conferences, you talk to like-minded people, you go to different organizations to find out what is it that you can do that's different, but still stay within the realm of what it is a dentist is supposed to do.
Right.
But provide a service, because I know people, if I was looking for it, then other people were also looking for it too.
Right.
So then that's how, through some studying and through some going to conferences and, reading and all of those things, that we were able to come up with the DC Dentist, holistic dentistry, alternative dentistry. And it's just recently on our office on Capitol Hill that we did the whole sustainable thing.
Okay.
Because that's also a part of what it is that I believe in, right?
Right.
To your footprint on the planet needs to be something that is not like, you just kind of like destroy stuff, right?
Right.
So our office is all sustainable. Every part of it is sustainable, from the flooring to the lighting to the paint to the equipment, all of that. We have a green roof.
Wow.
We use wind power, all of those things that we do, because it for me, it has to stay consistent to what your belief system is. I'm not really one to to change my belief system just because I have to do something at a particular job. You know what I mean?
Right.
You have to be consistent. And because how does it that you maintain some integrity if you're not consistent in your belief system? You know, so that's how I got into holistic dentistry, because I was looking for an alternative.
That sounds awesome.
Yeah.
Well, I'm happy to have you out there, because, you know, I've had some good dentists, you know, so when you know, then you know. But if you don't know, then you think that what you're getting, the service you're getting and the care that you're getting is good.
Until you see something else.
Right. So I had like a really challenging experience in 2004 where I have a condition called a vasovagal response. And that's when my blood sugar goes so low, it just knocks me out. So I'll pass out. I started when I was 3. At the Earth, Wind, and Fire concert, I was down. My family was like, what's happening? And then it went from there. So it has happened for decades. It just depends on what happens. Like, my body shuts down to protect me. So this particular night, my daughter, who was 15 months at the time, poked me in the eye in the middle of the night. So I get up and I go into the mirror because I think she gouged my eye out. That's the pain that I felt. So I look in the mirror, and my eye's good, you know, so I'm like, okay, I still have an eyeball. So while I'm up at like this 4 o'clock in the morning, I use the restroom. The next thing I know, I hear screaming. So I look up and I open my eyes and I'm on the floor on my back in the bathroom.
Wow.
And so it is my baby that's screaming. And I'm like, so I think I'm just going to jump up, and I'm like lightheaded. And I'm like, I must have passed out. I go to her, she's standing up in the bed, and I go to her and I'm like, what's wrong? And she pulls away from me. I'm like, what's wrong? You know, I look in the mirror and my whole face is bloody. So what had happened was I knocked out my front tooth, but I didn't know it then yet. So I'm not talking. I'm just like trying to figure it out. So I look in the mirror, I'm bloody. And then I taste sand in my mouth. And I'm like, why is sand in my mouth? So then I opened my mouth and there was Leon Spinks staring back at me. And I was mortified, mortified. And so that I would not pass out again from this shock, I jumped back in the bed and I called my best friend who lived around the corner from me. And so here we are at the hospital, tetanus shot, go to the dentist the next day. The dentist was having an argument with her husband on my day of her doing whatever was supposed to happen with this tooth, putting a filler in it or something. And so she is arguing with him on the phone from the next room. And then she comes and she puts this big needle in my mouth, I guess to numb it. I don't know. So just trauma all the way around. I'm like, I'm only however old I was, now I don't have a tooth. Nobody's going to like me. My tooth is not going to mean, you know, just all these things. So fast forward to now, I realized I got a root canal and I realized I got a cap or something. So I wanted to talk about root canals. I want to talk about what biological and eco-friendly dentistry is. I want to talk about cavities. I want to talk about the connections that we make. But I'm going to put a pin in the root canal talk, but I'd like to know, what does biological and holistic dentistry really mean on a day-to-day basis?
Right. Excellent question. And it's an excellent question because I get that a lot. You know, what is that? Because people really haven't had a knowledge and a concept of what it is. So I can only say what it is for me. There are a lot of people that say that they're holistic, biological, and they do different things. And then there could be a wide gamut of what it is that they say that they do. For us, it's that we do alternative therapies in the dental work that we do. So we use homeopathic remedies, we use supplementation, we use aromatherapy, We use herbal treatments. We use all of those things to augment the dental work that we do.
Okay.
The other aspect of what we do is to be very patient-centered. So that means that we don't do assembly line dentistry. Sometimes when you go to the dentist, it's like you're like a number. So we spend our time and energy and effort to make a connection with that patient, to find out what it is that's happening with that patient and how it is that we are able to help them. Because, you know, one of the things is that when a patient comes to see you as a dentist, that patient brings their whole self, right?
Absolutely.
So they bring their spiritual, their emotional, their financial, they bring all of that. So you can't just look at the person and say like, okay, this is like just a mouth, and there's nothing attached to the mouth. There's a lot of stuff that's attached to the mouth. And if you take a little bit of time to get to know what it is that's happening with that patient in other aspects of their lives that might be influencing what's happening with their teeth, then you've really given them a lot of service, right?
Right.
Because as opposed to just like, okay, you know, in your case, okay, your tooth is broken, you need to do this, da, 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 da. So you find out, you know, what happened. You know, that I passed out. Did I do this? You know, what happened? How did you feel? Da, 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 da. What is it that we can do to support you in that sort of thing? That would have been the way that we would have treated something like that.
Right.
But I think it's just having some care and concern for patients. Not to say traditional dentists don't have care and concern for patients, but for us to just recognize that the mouth also is connected to the rest of the body.
Right.
So those things in holistic dentistry, those things that you see in the patient's mouth is a direct reflection of what's happening in the patient's body, and vice versa. Those things you see in the patient's body are directly reflected in the patient's mouth. So because once again, it's a closed system. The patient and the patient's body, the patients and the patient's environment all work together to create what it is that you're seeing as a dentist. So for us, it's taking care of the patient, you know, taking care of the patient and finding out what it is that we need to do for that patient, and to do it in an atmosphere that is a relaxed atmosphere. We use aromatherapy. We use because I know dentistry can become people can be very anxious at the dentist.
Oh, of course.
Yeah, which is one of the reasons that a lot of times people don't go to the dentist, because they're very anxious. So we do our very best with the essential oils that we use and the homeopathic remedies that we use, that we're able to make the patient feel at ease, and just being able to make a connection with patients so that they know that you really have care and concern about them, and it's not just about what's in their mouth.
Well, Dr. Victor, you might not even remember this, but this was just in January. I was at your office. I was sitting in your chair, and I'm adopted. And so I found biological family siblings. And so you're talking to me and I was like, I'm sorry, I'm distracted. I just found a biological sister. I don't know if you remember that day. That was January, but I was sitting in and I couldn't even focus because we were just learning about her, and I was waiting for this picture.
Wow.
You know, I was waiting for my other siblings to send me a picture of her. So you were asking questions about it. And so I knew, you know, I knew that I had to say it, because I was just like, you know, all shaken, and it was a big day, but I knew that I just needed to get it out. And you asked questions. You didn't just push it to the side, and I felt comfortable even saying it.
Yeah.
Yes.
Yeah.
So the mind, body, and the spirit, like whatever's happening, it's all definitely connected. So I know one of the things that I learned later is that the tooth that was knocked out is on the Chinese meridian system of the womb, which is the number 9. And I have so many womb issues, you know, and so nobody ever told me that.
Yeah.
You know, my dentist prior didn't tell me that. I came with the knowledge already, knowing that there was a connection before I came to you. But I'd like to talk more about how, like, what you have seen. What are some of the things that happen to people, trauma or poor diets, that affect their teeth?
Yeah, it's so like you brought up with the meridian system. All of the teeth are, just as we spoke about before, the mouth, the body is like one continuous connection. We're not separate parts in our body. So what happens is that each of the teeth are connected to a particular meridian in Chinese medicine, which is connected to a particular muscle, a particular vein, a particular artery, a particular joint, a particular endocrine system, or something like that. It's all connected. So what you find happening is that if you have like an issue in one of your teeth, it might affect one of your organs or one of your joints.
Right.
One of the most amazing stories that I had at my office is with this young woman that came to the office. And if you're talking about how things are connected with your tooth, so she came to the office and she was having a lot of issues with her cycle, right? A lot of heavy bleeding with her cycle, and her and her husband were trying to get pregnant for a long time, and it just really didn't happen. And then, so she came to me because she had a root canal on this tooth at the bottom. And then she had a mercury filling, an amalgam filling on that root canal tooth. So we were going back and forth. Initially, we said that we were going to just take out the root canal, put a crown. And then we decided, no, what we're going to do is we're going to take out the tooth and then maybe do some other treatment, or an implant or a bridge. So she had been having these issues with her cycle all this time, right? So we took out the tooth, and then the next month her cycle was normal. And then the month after that, she got pregnant.
Oh, wow.
And she's had 3 children since then.
Oh, wow.
So it's like, and she, according to her, she's done nothing different. You know, all the things that she was trying to do from that, whatever, how many years I've been trying to do that, she was doing those things. The only thing that she said that was different was the tooth and taking the tooth out. So I think that there's some, you know, I guess people would say that that's not really scientific, right? It's not really scientific that would happen. But I could see that if there's not any other reason for thinking something happened, then it could be because of what it is that we did.
Right.
Yeah. And she was very happy about it. So there is a connection with that, and the other thing that you have to really be aware of if you're going to ascribe to that philosophy is that you really want to make sure that what you're doing in the patient's mouth doesn't affect some other part of the patient's body, right?
Right.
So let's say, for example, if a man has prostate cancer, and then the prostate, let's say it's connected to this tooth over here at the front, the lower tooth at the front.
Okay.
So you would probably want to kind of like not do like a lot of serious, like you wouldn't want to do a root canal on that tooth if he already has prostate cancer, or you probably wouldn't want to do like maybe like an implant there or something like that, because that area is already spoken for, right? And you kind of have to really nurture it along because you don't want to aggravate that.
Right.
So if you subscribe to that kind of philosophy about the meridians being connected, then it takes you to like another level of what it is that you're going to do, because then you're not just looking at the patient's teeth, you're looking at what is happening in the patient's body.
Right.
And to really be aware of what it is that's happening in the patient's body, and not just do something just for the heck of it.
Right.
You know what I'm saying?
So I wish, I'm glad that I know this now. So that's why I want to share this with everybody who will listen, because it really does make a difference. So I had, from being a child, I had, they called it soft teeth. That's what my dentist called it. It was soft teeth when I was like first going to the dentist, and I got cavities all the time. So I remember getting the dental dam and getting the funny gas and just always having to go to the dentist. Right. So now, so that's in the 70s. So then by 99, the dentist that I was going to then said, we need to get all this mercury out of your body. She didn't really explain why. She just was like, I just came from a conference. This is the new technology. So let's do it. So she's pulling all this stuff out of my mouth. And what I know now, however, 20 years later, is that she didn't protect us. She put in some kind of a white something that took it was just a whole process. But now I know that she didn't protect us, and I don't even know how she disposed of it. Right. Yeah. So then I've had a friend talk about it, and she said that they just put the teeth the mercury right next to her in the tray. So now my sister just goes to a integrative dentist in New Jersey. She said they came in with the hazmats, and they put the hazmat stuff on her. They like covered her all up, and they were covered when they were taking this mercury out. So can you talk to us about, like, for those of us who were 70s and earlier, and whenever they stopped the silver fillings with mercury, what is that? And what can it do to your body?
Okay. So, mercury fillings, or they call them amalgam fillings, or they call them silver fillings.
Yeah.
So you know that you have them in your mouth if the filling is dark. If it's black, then those are silver fillings. But you know, they haven't stopped using them. Yeah, they haven't stopped using mercury fillings.
Oh.
So the fillings, those fillings are anywhere from about 50 to about 54% mercury. And then, so the belief is that mercury is something that's toxic, right?
Yeah.
So that you really have to take some precautions in when you remove it, when you place it, who you're placing it. You have to be, you have to protect the environment for the patient also.
Right.
So there's an organization that your listeners and viewers should check out. It's called IAOMT.
IAOMT.org. Okay.
It's International Academy of Oral Medicine and Toxicology. So they have a lot of the work that they do is it's made up of dentists, physicians, PhDs, people who are very science-based, and they really do a lot of stuff around mercury. So what they recommend is that they have a protocol. So in their protocol, what you do is the patient is fully draped when you do that. The dentist and the assistants are wearing a special mask. The patient has oxygen, so they have an alternative source of breathing, so they don't breathe any of the mercury fumes. You use a special suction. There's a whole bunch of things. There's a whole bunch of things that they do.
Okay.
So that to protect the patient, to protect the dentist and the staff, but like I said, more importantly, also to protect the environment, because you don't want to release a lot of mercury in the room,
right?
And then the patient leaves, and then the next patient that comes in gets like a big whiff of mercury, and they're just minding their business, right? They're coming to the dentist, and you get this big whiff of mercury, and it's something that is not supposed to be that great for you,
right?
So traditional dentists would say that there's nothing wrong with mercury, that they still place it, and that it's something that they've been using for a long time. But for me personally, aside from the whole, mercury toxicity thing, I would say that the material itself we have much better materials today to replace your teeth, to replace your fillings than the mercury fillings that they put in now. That their same formula they've been using for like 100 years with that. I don't know any other branch of government that uses something that they used 100 years ago.
Right.
So we have much better materials to use today. And even if you don't believe in the whole toxicity of mercury things, and I think that there's no reason to place them anymore, because they don't do a good a job as some of the materials that we have today. And why not use it? Why not use that?
Okay.
It's much better for the patient. It's much better for the longevity of the fillings and all that kinds of stuff that you use. Aside from that whole toxicity stuff.
Okay. So what is your thought on fluoride? Because I know that they put fluoride in all types of in some water supplies, and then the dentist that I used to go to was very big on giving me treatments of fluoride. So I just wanted to get your thought on it.
My thought on fluoride is that the reason that they use fluoride is supposed to be stop cavities, right? So what fluoride does is it makes the tooth structure harder, so that they say that the cavities can't penetrate. What I was taught in dental school, and I think what everybody else is taught in dental school, is you get cavities because of bacteria, right?
Okay.
So for me, if we get cavities because of bacteria, why don't we make that environment inhospitable for cavities, as opposed to putting a substance into our system that'll make our teeth harder?
Right.
And then once again, we said that the body's connected, right? So if the body's connected, that substance that you're putting in your mouth, it doesn't go to your teeth. What does it do to your arteries? What does it do to your joints? Does it make those harder also? How does that work? For me, what we need to do is instead of doing something like fluoride, let's make sure everybody knows how to clean their teeth properly.
Okay.
Let's make sure that when we talk about foods, that you really want to make sure that you decrease your sugar, you decrease your white flour, you decrease all of those other things, so that the bacteria doesn't have stuff to eat. And why don't we do stuff where we give our children instructions on how to brush their teeth properly, so that we don't need to put something that's artificial on our teeth in hopes of killing bacteria.
Right.
Let's just control the bacteria by keeping stuff really clean.
Okay.
So that's my take on fluoride.
Okay.
And there's some neighborhoods and there's some areas that are non-fluoridated that don't have more cavities than the fluoridated areas.
Right.
So I think a lot of it is just education,
right,
and how it is that you do that. And
Okay.
I think it's something that we could really do much better on.
So it's interesting. My dentist always used fluoride, and I didn't know. But once I knew, then I questioned, why are we doing the fluoride? And they gave me the whole, like you just said, it helps to fight the cavities. So eventually I stopped. I told them no more fluoride. And they were so like, every time they would try to sneak it in or keep, like, every time I said, write it in the notes so that you don't have to keep asking me, so that we don't have this awkward moment when I'm telling you I'm not doing this fluoride. So then I stopped using fluoridated toothpastes. I actually started making my own. I go in between. I change it up so that it's something new, different. And I haven't had any more cavities, whatever. But I had so many from the beginning. I'm just like still working at a deficit of trying to, take care of the old ones. But, I've been doing other things, and I want to talk about this too, and some tips for people on how to brush their teeth better and what kind of the things that they can use and all those kinds of things. But one little note on the mercury. So got these fillings in the 70s, got them removed in 99. By 2013, now I'm a patient of Dr. Sakaliva Mines at the Institute of Multidimensional Medicine. And she does that biometrics thing on me. And she finds all this mercury in my body. Right. So then I go through this whole round, like a year's round of colon hydrotherapy and foot baths and sitting in the infrared sauna and getting, So it was still in my body, So what do you think about that?
Yeah, I think that what happens, and that's an important part of what it is that we do also, is that you have to, with the whole process of thinking of that the patient is a whole person, you have to be in touch with the person's physician, because you're not just, like I've said before, you're not just looking at the person's mouth. So it's the same person that your physician sees, the same person that the dentist sees.
Right.
So that's why we form relationships with physicians like Dr. Mines and other MDs, other naturopaths, other chiropractors, because it gives us a more well-rounded offerings to the patients, and that they're able to benefit. The person that benefits the best from that is the patient, because then your dentist and your physician are talking about what it is that they need to do and how it is that they need to do it, because we're still the same person,
right?
But you have to get rid of that stuff if your physician says that it's still in you. Because I would suggest that you definitely get rid of it, because, and they're able to provide ways, like Dr. Mines is awesome. I mean, in the stuff that she's able to do to provide ways to get rid of it,
So I bet y'all never heard that before. So just, keep following along. Now, I have heard about, like, I don't know what years these were, but I know some of the highest statistics of medical professionals who commit suicide are dentists. I don't know. Is that true?
Yeah, that's what I've heard.
It's true.
Yeah. Dentists have the highest rate of suicide, divorce, maybe even substance abuse, all of those things. I think part of the reason that is that it's a stressful job. People come to see you and they're tense, they're anxious. It's not like they're going to get a massage, right?
Right.
So, and then that itself makes you tense and anxious. And then also that, one of the things I think that you don't want to hurt somebody. So you therefore you get more tense and you get more anxious because you don't want to do anything like that. And then I was reading somewhere not that long ago that they were saying that they thought part of it was because of maybe even some of the toxicity that's in dentistry.
Well, that's what I wanted to say. Yeah.
Being around that stuff all the time, and that stuff getting inside of you.
Yeah.
I had a friend that's a dentist, and he was in Detroit, and he was saying that he had, before I met him, he was saying that he had like suicidal thoughts. He was in the process of getting a divorce. He was doing all of this other stuff. And you know what he did? He went to do the same thing that you did, the mercury detox thing. And he said in a matter of like 6 weeks, he was like a totally different person.
Yeah.
So once again, this is like my story about the woman with the, and they would say that that's like anecdotal, right? That's anecdotal story. But there has to be something, there has to, some people don't just change just like that. So I think we just need to be careful.
I like to say, use your wisdom.
That's what I say. Yeah. Just be
these
careful.
are anecdotal if you want them to be anecdotal. But then also, if you have been affected by it or your health has been improved by it, then why don't you think that this could be it? So I just always implore my listeners to just use your own brain sometimes.
Yeah. And use your judgment. Not everything that everybody says, whether it's like holistic or biological, not everything that you have to do, because there's some things out there that probably is not that great.
Right.
But use your judgment, or use your sight,
your intuition, and study, because you have the whole world in front of you. If you have the internet, you could go out there and figure things out, and then ask professionals. So we have 30 minutes left. What I wanted to go to, you're saying, we were talking about things that may or may not really work.
Yeah.
So let's talk about oil pulling, charcoal and clay and things like that. What do you think about
you're getting
those?
all the good stuff today, right?
Yeah.
Okay, so let me tell you about oil pulling.
Okay.
So oil pulling is like an Ayurvedic, which is like from India. Their system of medicine. And what it is that you use holistic, organic coconut oil.
Yep.
And what you do is you swish it back and forth in your mouth for maybe about, 15, 20 minutes or so. And then it's supposed to kill a lot of bacteria. It's supposed to make your mouth feel much better. So, a lot of my patients were coming to me and talking to me about this oil pulling thing, and I never knew about it.
Okay.
And they were like, "Oh, this is great. What do you think about it?" And da 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 da. So I was like, I don't know. Is it working for you? If it's working for you, then that's great. So I tried it. Okay. And then I thought that it worked.
Okay.
But I have, what is interesting is that I have a friend of mine, a colleague who's a periodontist, and she does research. So she's from India. So she was saying that she wanted to do some research on this oil pulling. And it turns out what happens with the coconut oil is it coats your teeth. So it's like it puts like a film on your teeth.
Okay.
And they call that substantivity. If you have a film on your teeth, the fluoride is kind of like supposed to, when you get those fluoride treatments, it's supposed to do the same sort of thing.
Okay.
So that's how it kind of like decreases. So what we're going to do is, she wanted to do like a research paper on that to see if indeed that works. But I think that it would work, because that's how, if it works for other things, then it would work for the coconut oil.
And a lot of, if you look at the ingredients of even like healthy toothpaste, it has glycerin in it, which covers the teeth.
Yeah.
So it might be the same thing.
So I'll let you know on how our study goes.
Yeah, I would love to hear. I would love to hear
and see about oil pulling. She actually she's at our office. She's a periodontist.
Okay, so I have been doing it for maybe the last 3 or 4 years, just because I was studying it. And I feel like when I come to the dentist, they don't say there is more stuff going on. It's just the old stuff.
Yeah.
So I feel like it helps me.
Yeah.
And then because I have this root canal, I want to make sure that I keep it clean.
Yeah.
Because I've seen people who have teeth that are not theirs, and you see that black.
Yeah.
And, so I just try it. And then I've also included charcoal occasionally. Now, this is not something I do every day. Because you still want to keep the balance of your mouth, healthy balance. So I do it occasionally, like a few times a week, and then I do charcoal a few times a week. And I used to try, before I was doing the charcoal, I used to try clay, and but the clay turned my teeth gray.
Like bentonite clay.
Yeah, bentonite clay.
Bentonite clay. Yeah.
And it would just be a few little particles, and then I'd put it in there with the coconut, but it turned my teeth gray, and they would stay gray for like 2 or 3 days. So I stopped that, but the charcoal seems to work. And then I make sure that I floss with it, and I put a little tea tree oil and some other things, sometimes clove or and then I floss using it.
Yeah.
And then Dr. Mines told me to occasionally, and this for my tooth and other places, to do a little bit of what am I thinking? stuff that bubbles when you put it in your mouth.
Hydrogen peroxide.
Hydrogen peroxide, just a little bit, and then go to sleep with it overnight. Yeah. So I do that too.
Yeah.
So what do you think about those things?
All of those things are good.
Okay.
The tea tree oil is it kills bacteria.
Right.
The hydrogen peroxide will make your mouth more alkaline.
Okay.
You know, all of those things. I have a lot of patients that use charcoal, and they swear by charcoal. It makes they say it makes their teeth white.
Okay.
You know, so all of those things are good. I think and the flossing is also very, very good because, flossing gets in between your teeth, whereas if you just brush your teeth, it doesn't really get in between your teeth. And it's between your teeth a lot of times where cavities get started.
Right. So
flossing is one of the really important things to do. But all of those things, as far as like brushing your teeth and all of those things are very good. You can make your own toothpaste. I think that's fine. Okay. That's not a problem.
So can you tell us what are the best ways to brush our teeth and what you would put in a toothpaste if you were going to make it for yourself?
What would I put in a toothpaste? Okay, so when you brush your teeth, what we recommend is believe it or not, is like an electric toothbrush. An electric toothbrush works very, very well. That now they have them where they have if you put too much pressure on it, if you put too much pressure on your tooth or on your gums, it'll stop.
Oh, okay.
Whereas with the manual toothbrush, it can cause a lot of damage to if you're not careful with it, it can damage your gums. Right. Because you can literally brush your gums away, especially if you
gums don't regenerate, right?
Right. That's it doesn't regenerate.
Jessica's going, wow.
So what you want to do is you really want to, if you're using a manual toothbrush, make sure you use a soft toothbrush. Yeah. Right. Soft toothbrush, because the hard ones, and a lot of times people think that you can you just need to scrub away like you're doing the kitchen floor or something, but it doesn't need to be that way. The way that the Creator designed our teeth, they're almost self-cleansing. So what happens is that even if you just rinse your mouth out, brushing takes off a lot of the large particles of food. But the flossing, why it's important, is because it gets in between where the small particles are, and that's where the bacteria will get to. So that's why you can put anything on the toothbrush and then just use it to brush your teeth, because the purpose of brushing is to just take off those large particles of food that you have there, so that the bacteria doesn't start to eat it. What I would say is what to look for in a toothpaste. If you're going to get a toothpaste from, let's say, the health food store, or even if you're going to get it from CVS, you look for something that doesn't have any sugar in it. Okay. And you have to look at sugar can be disguised in a lot of ways.
Xylitol and all types of stuff.
Yeah, all of those. Make sure it doesn't have any sugar in it. Make sure it doesn't have any of the chemicals in it. So sometimes you see a whole long name with a number at the end. If you can't pronounce it, then it shouldn't really be in your toothpaste, right? So the sugar, and then as much natural ingredients as possible. Some of those things that you mentioned with the tea tree oil, that stuff is really good. If something it's baking soda based, that is also also very good. If you want to, the charcoal, like we said, because they say that is supposed to help with the whitening of your teeth. The baking soda too, it makes your mouth, your area of your mouth more alkaline. So the bacteria that in your mouth doesn't really it likes it to be acidic. So the alkaline makes it inhospitable for it to be there. Okay. So all of those things would help.
Okay. That's good to know. So please.
And then let me tell you about mouth rinse too. Then, if we're going to talk about toothpaste, mouth rinse is also very good. The same thing too. Make sure it doesn't have any sugar in it. Okay. Make sure it doesn't have any. The big thing with the mouth rinse is make sure it doesn't have any alcohol in it. Because they put a lot of alcohol in mouth rinse now. Like the traditional mouth rinses that you get, they have a really high content of alcohol. Okay. So alcohol is something that dries. It's drying. So you don't want your mouth to be dried. Your mouth is always supposed to be wet. But if you put alcohol in there all the time, it's drying. Right. And that causes, actually, believe it or not, that causes you more cavities because your saliva is not there. Our saliva has antibacterial properties in it. Okay. So you want to maintain a lot of saliva in your mouth and not have it dry like the alcohol would do. So the same thing with the mouth rinse. Get something that's really natural, something, and once again, mouth rinse, you can make that yourself. Yeah, also.
I was going to say I was making it. What do you suggest?
What do you suggest?
I used witch hazel with no alcohol in it.
Yeah,
and then I did a and this was just a recipe that I got because I also took a essential oil class.
Yeah.
Like I take all these classes, I'm trying to figure out my life. So they said witch hazel with no alcohol, a few drops of whatever you like, essential oil. So I did clove, I did cinnamon, and I did tea tree.
Yeah.
And then a little bit of baking soda and a scoop of oil.
Yeah.
That's what I use.
All those things are really good. You just have to make sure with that, the tea tree oil and like the cinnamon that you don't put too much because those are like tea tree oil is very strong.
And it has to be one that is like a doTERRA, which I don't push anything, but a doTERRA is one that's more ingestible than just the regular one. So you have to be careful.
Yeah. You really have to be careful with that. But yeah, that's good. You need to start marketing that stuff.
So what do you think about, what about breath health? And gum health? How can people, help themselves?
Yeah. With the breath issues, it depends on where the breath issues come from, right? Because sometimes if you have like a gum disease, periodontal disease, or what they used to call pyorrhea, then it's an inflammation of your gums. And with any kind of inflammation, there's bacteria there. And then if bacteria is there, you might get like a smell. So the first part of it is to make sure that everything that's happening in your mouth is like very, very clean. And that usually takes care of the issue. If that doesn't take care of the issue, then what you want to do is you want to look at some other sources. Maybe something it is that you're eating that doesn't, when it breaks down in your mouth, it doesn't quite go away, and it's causing an odor. If that doesn't do it, then you look at maybe like something that might be happening with your stomach. Yeah.
Right.
So because like we said, once again, we come back to we're all one person. We're all connected. So there's like direct line from your stomach all the way up to your mouth. Another place that you might want to look at, if that doesn't do it, is to look at your nose and see if you have like sinus infections and those sorts of things, because then that also is like a connection also with your mouth, because there's like a direct connection. So you want to look at all of those things. But to be honest with you, most of the time, if you take care of the oral part of it, that takes care of most of it. And you get like a good mouth rinse. You keep your teeth very, very clean. Most of the time that ends up taking care of any kind of like breath issues that you might have.
Okay. So let's talk about some food, because I always like to talk about things that nourish.
Yeah.
What are some good foods for a good, healthy mouth?
Oh gosh. Yeah. So, any plant-based diet, I would say plant-based diets support your teeth the same way that it supports your body. It supports your teeth. So you really want to get rid of the sugars. You really want to get rid of the white flours. You really want to get rid of the processed foods. You want to get rid of the fried foods. All of those things that I'm sure that your physicians or your holistic nutritionists will tell you that those are the things that are good for your body. Those are the same sort of things that are good for your teeth. And what you want to also do, if we're just talking about the teeth in particular, you want to get things off of your teeth. You want to get food off of your teeth, because what happens is that bacteria just needs like a tiny, tiny, tiny amount of food particles on your teeth. And if you think about, if you go to sleep with that particles of food on your teeth, and your mouth is closed, it's warm, it's moist, it's like a bacteria heaven there.
Right.
And if you're sleeping with that, right? If you're sleeping with that and that bacteria has that for 8 hours, right?
Right.
That's how you start to get into trouble. But if before you go to bed, if you do that protocol that you're talking about, that you do, and it's the last thing that you do before you go to bed, you don't eat anything afterwards, you don't go and have like some kind of like sugary drink or something like that. If it's the last thing that you do, and then your mouth is in a healthy state, and the bacteria is not going to really like that environment.
Right.
So all of those things are important.
Now, what do you think about tongue scraping?
I think tongue scraping is okay. I think tongue scraping is okay. You could, because what happens is that with our tongues, that's another source of
Ayurvedic. That's an Ayurvedic thing.
Yeah, yeah. And that's another source of breath issues, because our tongue has these little grooves in them.
Okay.
And if you get food that gets stuck in those grooves, and that food starts to decompose, it could have a breath issue also. So if you're having breath issues, that's another thing that you could also try to do. With those other things we just mentioned, is to do the tongue scraping.
Okay.
Yeah. I don't think that causes any harm.
Okay. Yeah. One of the things that I heard, is that when you wake up in the morning, because your body, if you have gotten the proper rest, it regenerates, renews, restores, and all the cells do their thing. And part of the stuff that needs to be detoxed is sitting on your tongue. And that's why you have the taste in the morning.
Yeah.
So before you even drink, before you do anything, scrape your tongue with a metal tongue scraper. And then brush your teeth and then go about doing whatever you're going to do, drink your water, whatever you're going to do.
Yeah.
But they say that helps because if you don't, then you kind of reabsorb some of the toxins because your lymph and everything is trying to detox. So that's just something that I was taught. So it made sense.
It makes sense. You know, I don't know, the ins and outs of it, but I would think that if you're able to keep stuff clean, then that would help in all different kinds of ways.
So let's talk about how to take charge of your own care. Like for our listeners who may have never heard of any of these things before, what are some questions they can go and ask their own dentists or physicians?
That's an excellent question. I think that one of the things that you always have to be aware of your listeners and your viewers is not to give somebody else your power. I think if you're going to come to someone, and it's not just you're just going to come to the dental chair or come to the physician's chair and just sit there and say, okay, fix me. What do you want me to do? Because, you know, you have to have like the power to do those things that you want to do and those things that are good for you, because nobody can tell you to. If you don't believe it for yourself and you don't want it for yourself, then it's not likely that it's going to happen. Right. So that's one of the things that I would say is that take charge of your health. You know, if you're overweight, if you have high blood pressure, if you have whatever, high cholesterol, if you have like other health issues, then realize that there's like lots of different things that are out there that you can do, but not to just put your sole energy into your practitioner. Yes, your practitioner, and this is just my philosophy, your practitioner can help, and we both can be on that road together. And there's certain things that I can help you with, and then there's certain things that you're going to have to do, whether it's just changing that diet, or, you know, turn off the TV, or, you know, get that exercise, go walking. I can't do those things for you, but you have to maintain a certain level of power. And then when it does happen and you are healthier, then you can keep that because you know that you've done that for yourself. And nobody can take that away from you, right? Right. And then you know that if you can do this for yourself, then maybe you might want to do something else for yourself. Like, you know, that job that you hate, that you keep going to every day because, you know, or that business that you want to start because you think that you can do so and so. Maybe that'll give you that some kind of like confidence to think that you can do that. Empowerment. Yeah. So that's a good word. So I think that what we try to do is we try to empower patients. You know, you can show people what it is that's happening with them. And it's like, how is it that you get empowered to make a change? How is it that you get empowered to go from this level to this level? Because that's how we become better people. Right. You know, and that's how you feel better about yourself.
Absolutely.
Right? Yeah.
I love that. And I'm glad that you said that, because I probably just like in the last 7 or 8 years learned that the doctor is my vendor. That, you know, that's how I think about it now. The doctor is my vendor, and you are allowed to fire vendors that don't that don't provide, you know, the care or the attention or whatever, the service that you are paying them for. So I think that especially Black and brown people in my research, we kind of give our power or have given our power, and we are, you know, whatever they say goes, you know, and I know family members who have done that, especially when I was younger. My older family members, the doctor said, take this, and this, and they would just do it, you know, without any questions. So in my case, I fired my regular doctor. 10 years I was going to her. And then I started going to Dr. Mines, and it was only because when I started there, the first visit that I had with Dr. Mines, she had me there for 2 hours. And she asked me questions that my doctor in 10 years had never asked me before. And they were basic things like, do you drink water? The lady never asked me if I drank water in 10 years. And I never even thought about, she didn't ask me that I drink water. And so Dr. Mines says, you know, that. So I fired her. And then, you know, so that was no love lost. It was fine. But my dentist, you know, my dentist that I loved for all those years, it was really like, I felt some kind of way knowing that I had to break up with him to come to your practice, right? And that was recently, probably just in the last year. I always knew about your practice, but I just was holding on to my dentist. But then when I started to study the biological, holistic, eco-friendly part of dentistry and realized that that was not what he was doing, you know, I had to make a decision because it's self-preservation. You know what I'm saying? And then I was empowered enough to make these decisions. So I had a conversation with him because I wasn't just going to like just leave. And he was so gracious and he understood. And I think that he also remembers, because I actually sent him some information on the class that I was taking for and he was so excited. He said, "Oh, I'm going to really get into it." And he didn't. So then I'm like, you don't even know these things that I'm learning. Like if you don't know, and I'm a lay person and I know, then I have to go. So that's what I did. And it was an interesting dynamic, but you know, I'm happy to be at your practice now. And I tell people about it, which is why I wanted you on the show, because I want more people to come.
Well, we're glad to be here, and thank you so much. I think part of what it is with the with what we call, like, I guess, traditional dentistry or traditional medicine, that's how they were trained. You know, that's how they're trained.
It wasn't his fault. But I gave him more information and he didn't go for it. So that was the thing.
That's true. That's true too. So it's how they're trained. And sometimes you have to have somebody that you are on the same page with, that same thought process. So something that the practitioner and the patient have to have agreement, right? If you don't have agreement with your practitioner, then you're constantly at odds with them. So whether that's your dentist, whether that's your therapist, whether that's if you're not agreeing with the way that they're treating you, how is it that they can help you? If everything that they're telling you is like, "Oh no, I don't believe in that." If it's not in your belief system, you're not likely that you're going to do it. So some practitioners who are traditional, they will honor people's belief system and maybe kind of like bend in ways that they could kind of coexist. But some practitioners are very very straight and very direct. This is how I do it. This is how I was trained, and you know, that nothing else. But I think that there has to be some kind of commonality there, you know, because that's how you're going to, how's somebody going to help you if you don't agree.
And I also think that when depending on how you consume and absorb information and research information, you start to learn more, and then you attract. You know, you attract that same thing. You were always on my radar. I just was still doing my thing. So then when I realized I need to do something different, then I just did something different.
It happens.
I wanted to ask about what, in your opinion, are the newest technologies when you go to these conferences and things. What's new and popping in dentistry, holistic dentistry these days?
Holistic, there's a lot of different things that's popping in holistic dentistry. One of the things that they're really trying to find out is what causes the bacteria in your mouth to cause cavities. Because if you're able to, is there like some kind of gene or something that really kind of gets turned on? And if you can turn that off, would that mean that, you know, now our children can grow up without ever knowing what a cavity is? Which is, to me, which is really exciting. In dentistry now, there's a real move to going towards digital. So there's like digital x-rays. You now can take like 3D x-rays where you can kind of like really see what's happening in the patient's mouth. We now, instead of taking molds with like the impression material, we now use a scanner. You know, and then you scan the patient's tooth, you take that file and you send it to the lab, and then the lab will make a tooth from that. You know, it's really, it's amazing. You know, it really is. This is a time, I think, in dentistry where there's a lot of stuff happening. They're getting to the point where you're going to be able to use like a digital printer. So if you scan that tooth, instead of sending it to the lab, you can just digitally print it right there in your office, and you can just, you know, just do the tooth right there. There's a lot of things I'm excited. We want to be really on the cutting edge of stuff, you know, so you don't want to be stuck in the past. We want to be moving forward. And I think that we're positioned to do that.
Now, do you have a network of other melanated dentists who are doing this type of dentistry?
No. Other than the dentists at our office, No, not really. I don't really see, they're few and far between, none really in this area. If we're talking about, you said melanated,
African descent or whatever you call yourself. Yeah.
No, not really. There's us, there's like, 3 or 4 of us at our office.
Wow.
And
in this area, that seemed like it would be so many more. Because
yeah. And you would think, especially with Howard how the dental student being there. Yeah. I just did a lecture at Howard last week.
Well, that's what I was going to ask. Are you like talking to the dental students? Do they allow you to come in? And
I've been there. There's something that we do with them with students that want to come to the dental school in the summer. And then, like I said, last week I was there and I spoke to some of the professors that were there about holistic dentistry because they were interested.
Okay.
So maybe, it's something that could develop into something that, we'll see how it how it goes, but I'm not sure. Because there's like a process. I mean, they have like, they're pretty strict in their belief system. You know what I mean? So if something comes of it, that's fine. If not, then that's fine. Also, we're doing some service work to our patients.
Okay.
Yeah.
Well, what I liked about my experience was in coming there is that because I had kind of studied some of these things and I don't have all the answers. I just have seeds that were planted to make me ask questions. Mm-hmm. And sometimes when you have that kind of information, I was very careful not to come in with like as the know-it-all. But when I spoke to you, and then I've had Dr. Jada more times than I've had you as my dentist, and she would just answer the questions and help me figure it out like a puzzle. So what I like that instead of the side eye that, a professional will get like, I've been doing this for 30 years. This whippersnapper comes in talking about some oil pull and who are you? So I didn't get that. And I was grateful for that. And, I'm still figuring out my issues, not issues. I'm still figuring out the things that I can better, that I can improve in my dental care. So I'm excited that you all are available to help.
Oh yeah. It's like it's a process. It's just like life, right? We have like layers and we go up to different levels and those sorts of things. It's the same sort of way. What was acceptable to you 20 years ago is no longer acceptable. You know, and we move in life, and I think that's how it is.
Okay. So I think we have like 3 or 4 minutes left. What I would like to do is for you to tell people how they can reach you.
Oh, we can be reached at thedcdentist.com is our website. Our telephone number is 202-544-3626. We're located in Capitol Hill by Eastern Market at 11th and Pennsylvania.
Okay.
And what else we got?
So tell us, because we have like a few minutes left.
Also on Instagram.
Tell us about, like, you have events occasionally. So like, I've never had a dentist say, come to this movie screening or come to this conversation. Where did you get that from?
We do a lot of different things at our office. You can come to yoga. Every Friday we have yoga at the office. We have a great Kwesi Karamoko. He does comedic yoga.
Oh, wow.
And it's like, pay what you can and come to the office and do some yoga, because it's all together. Like we said, we're ending the same way that we started. Right. It's all holistic. We're all connected. If we can get you to do yoga, and if we can get you to come and do some of the programs that we have where we bring in some practitioners sometimes to talk to our patients about different things that we do, then that makes you better. That makes you better. Then that's good. We're doing what it is that we're supposed to do.
And then you also have an event for other integrative, holistic practitioners. What does that look like? Yeah,
that actually we're really excited about. It's coming up.
Okay.
And what is it that we have? Because you know what? There's so many of us that are out here doing stuff. It's good to know what other people are doing. So you could use it as you could refer to each other. You could, what I would really like to see is for us to get together on a regular basis, because you know what it's like to be a healer, right? You're giving out a lot of energy to people all the time. So sometimes, you have to be able to get together with those people that are doing that, and we can support each other. We can we can talk about things. We can determine how things should be treated and that kind of things. I think it brings a certain amount of camaraderie to the alternative practitioners that are in this DC area.
Okay. Yeah. There are lots of different people. So that's awesome.
Yeah, there's a lot. Yeah.
See, you all, you welcome. I'm giving you some good information here. You have Dr. Terry Victor from the DC Dentist. So I wanted to thank you for coming.
Thank you.
Yes, great information. Thank you so much. And for those of you who are familiar with the Sanctuary, please don't forget to check out my book, From Jersey to Me, The Awakening and Healing of a Goddess. I'm still in pre-order. You can go to my website, wendycherry.com/book. We will see you next time in the Sanctuary. Thank you again for joining us. Peace.
Peace.